Having frozen shoulder will not only limit your mobility, but it will also create chronic pain that you just can't get rid of. And what's worse is everybody keeps telling you that's going to take years of physical therapy just to see decent results. That's why in this video, I'm going to be showing you how to speed up your recovery for your frozen shoulder. Adam here from trainingmassage.com. I'm sure a lot of you are pretty skeptical about me saying I can speed up your recovery process for your frozen shoulder. So let's quickly go over how it's going to work and why you should do it. One of the most common treatments for frozen shoulder is going to be things like stretches and exercises to improve the mobility and the blood circulation in the shoulder. And even though there's nothing wrong with this and it is correct, it can take several years to get your full mobility back. You see, frozen shoulder is caused by thickening of the connective tissue around the shoulder joint, resulting in it being painful and difficult to move. But there's also another theory out there that can explain your problems. According to Travel and Simons, a frozen shoulder might actually be created thanks to a muscular dysfunction rather than an adhesion, which means the issues are more in the muscles and not the connective tissue. But what kind of issues are we talking about here? We're talking about trigger points. Now, I've already covered what a trigger point is in another video, and I'll leave a link in the description for that one. But a quick summary of it is that it's pretty much a small spot within the muscle that stays in a contracted state, resulting in pain, limited mobility, and even weakness in that muscle. On top of that, trigger points will also shorten muscles, meaning when a muscle shortens, it's going to pull on the joint it's attached to, favoring that direction. And in terms of favorability for frozen shoulder, those movements are going to be adducted towards the body and internally rotated. This may explain why it's painful to move your arm and why you have limited mobility as well. And what's cool here is we even have a study to back this up. This study, conducted in June of 2021, took 100 patients with frozen shoulder and tested to see if they had trigger points in the subscapularis. And what they found was that there is a strong correlation between frozen shoulder patients and trigger points in this muscle. Meaning, if you're someone who has frozen shoulder, then there's also a high chance that you have trigger points in your subscapularis, which we'll get to later on. But that's not all, because I would say that it's a mistake to ignore the other studies that show an increase in the thickness of the shoulder ligaments and tension, resulting in the shoulder getting pulled into the scapula and making it tight and restrictive. So what do we actually do with this information? Well, you actually work on the connective tissue itself, just not the ones you think. You see, there is connective tissue within the body that not only creates constant tension, but also wraps around your muscles and through your ligaments. That connective tissue is fascia. And if it gets tight thanks to overuse, bad posture, or an injury, then it will begin to build layers on top of layers in that one area, resulting in everything else getting pulled toward that tension spot. And of course, we also have some studies that back this up. Regardless if you're using something like a massage gun, a foam roller, or a scraping tool, going through a myofascial release for your frozen shoulder and other muscles in general is going to help improve your mobility and your pain. For example, in this study, there was a group of 30 people with frozen shoulder divided into two groups, one with conventional therapy and the other with scraping plus conventional therapy. And what they found was that the group that included the scraping techniques had better mobility and function in their shoulder, and they got the results in just a few weeks. I do want to be clear here that there wasn't really a big difference between the pain levels between the conventional therapy and the scraping team, but in terms of range of motion and function, scraping team wins. Or you have this study that shows using a simple vibration device on 23 people with frozen shoulder helped improve their overall range of motion and even their sleep quality. And what's crazy here is that if you take a look at the chart, you're going to see that most of them got their biggest jump of improvements after the first session. What these studies tell us is that by using myofascial release techniques on your frozen shoulder, it's going to help you not only improve your mobility and decrease your pain, at least with some of the studies, but it's also going to help improve your shoulder function. So with all that said though, what's actually going on in the body and how does a myofascial release work? The basic idea of a myofascial release is to help release the fascia's grip on the muscles and the tissues around it. You see, when you have an injury, whether it's by something traumatic or you just have a bunch of little micro injuries that build up over time, what's going to happen is that fascia in that area is going to end up building layers on top of layers and begin to harden, very similar to what happens to a scar, basically. Now remember that your fascia does connect to pretty much everything, which means when you get this hardening in the fascia, it's going to begin creating tension in that direction, pulling not only the tissues but also the joints with it. Very similar to a black hole, how everything just goes straight to it. This is how tight fascia in one area of the body can create pain in a different area of the body. And it's most likely what's happening within your shoulder, just at a much larger scale. So hopefully by now you're convinced that a myofascial release and even trigger point release is the way to go to speed up your recovery for your frozen shoulder. Which means the only thing left here is for me to show you how to do these different techniques on the muscles that are most likely affecting your frozen shoulder. Now we are going to be breaking this up into two different parts, with the first one being working on the trigger points and then the second one being working on the fascia restrictions. Starting with the trigger point release. The way you're going to perform a trigger point release is by either applying static pressure or deep strokes across the most tender spot within the muscle you are working on. Now, a few key things to remember here is that number one, it's going to be uncomfortable, especially if you've never done it, and that's okay. It should technically be a little uncomfortable here. Just make sure you're able to breathe throughout the technique. And since it can take anywhere between 1 minute, between 5 minutes, it's important for you to pay attention what's happening to that trigger point and even where it goes, because chances are it can move, dissipate, or just go away pretty much. Now, first up is the pec major. To work on trigger points on this muscle, I highly recommend using something like an MB5 ball on the floor while you're laying flat on your stomach. Now what you're going to do here is take your massage tool and place it underneath your pec major onto the most tender spots. Now once you're on that spot, you're either going to apply some static pressure by just hanging out there and taking big deep breaths. Again, it should be somewhat uncomfortable here, or you can do what I like to call deep strokes, where you're just pressing as hard as you can. Again, you need to tolerate it, and you're just simply stroking across the trigger point, going back and forth. Make sure to work these trigger points for 1 to 2 minutes, and yes, there can be multiple trigger points in each muscle. Next step is going to be the anterior deltoid, located right next to the pec major. Just like the pec major, find the most tender spot and work on it by either performing static pressure or micro movements. Once again, do this for 1 to 2 minutes for each trigger point that you find. And before we go into the rest of the deltoids, we might as well finish up the techniques we can do on the floor here, and that is going to be working on the lats. Now, usually you'd want to place your arm up in order to access the lats on the sides, but with a lot of you who have frozen shoulder, that's going to be pretty much impossible at this moment. So what you should be doing here is trying to lay on your back, but on the side, and aim a little lower, pretty much a little below the ribs and right on your lower back, mid back region. That right there is going to be how you target your latissimus dorsi. Now, once you're on the muscle, go ahead and find the most tender spot you can find, and then either apply some static pressure or some deep strokes for 1 to 2 minutes. Now from here, going to stand on up and lean against the wall in order to work on the medial and the posterior deltoids. Here you're going to see on the left side you have the medial deltoids, and on the right side you have the posterior deltoids. Just like the rest of the techniques, you're going to be doing some static pressure or micro movements. But what's great here is that as you work on your posterior deltoid, you're also working on your rotator cuff muscle right beneath it, the infraspinatus, and the teres minor. This might also be why that area feels more tender than the rest. Once again, work each trigger point for 1 to 2 minutes. Now that we worked on all this superficial muscle, it's time to get into the deeper muscles like the rotator cuff muscles, starting with the supraspinatus. This muscle sits on top of the shoulder underneath the upper traps. And to locate this muscle, it's best to first find the point where your clavicle and your upper portion of the scapula meet, and then drop down between them in order to find your supraspinatus. Now, it might be a little hard to actually press into this muscle thanks to the upper traps that sit on top of it. So in order to passively contract the upper traps, which allows easier access to the supraspinatus, you can either try to elevate your arm by placing your hand on top of an elevated surface, which will push your elbow up and create a small contraction, passively of course. You can also tilt your head to that same side and just let it rest there, which will also create a slack in the upper traps, giving you easier access to the muscles underneath. And once you finally get access to that muscle, go ahead and work on it by either applying some static pressure or deep strokes on the most tender spots for 1 to 2 minutes. You can confirm that you're on this muscle by lifting your arm up when you find a tender spot, and if you feel it contract, then you know you're on it. Now, one of the biggest troublemakers in frozen shoulder is going to be the subscapularis. We saw that in a study earlier, which means this is definitely something we want to work on. Now, this muscle is located on the the anterior side of the scapula, which means if we want to access it, then we need to go in from the front and through the armpits. Now, since most of you are, again, going to have issues bringing the arm up, which is going to allow you to pull that subscapularis out, I highly recommend doing something very similar to the Superp Spinatus here, where you place your arm on top and then either lean back a bit, or you're just going to drop down, which is both going to create some passive shoulder flexion. And an extra tool you're going to need here is also going to be a broom handle. Take the arm and place it on top of an elevated surface and then step back a little bit in order to expose that scapula. And once you're in position, take that broomstick and stick it into your scapula. This may feel a little awkward at first, so in order to guide you there, I highly recommend sticking next to the ribs until you come to a hard stop. There is two kind of stops here you'll feel. You'll first feel those lats, which is a little more muscular, a little softer, and then you'll come into a harder stop, which is going to be your scapula. Now from here, do your best to get that broom handle into the middle of that scapula so you can begin working the trigger points. Don't force this tool into that area because chances are it's going to be really tender. And of course, we don't want to aggravate it more than anything. We just want to release it. Once you believe you found the muscle, go ahead and release it by performing some static pressure for 1 to 2 minutes. Now that we've worked on all the trigger points, let's work on the fascia system. What we're going to be doing here is targeting 3 different areas within the fascia, and we're going to be targeting each one using different tools, starting with the pectoral fascia and a lacrosse ball. What you're going to do here is take the lacrosse ball and stick it into the chest with as much pressure as you can tolerate. Now from here, slowly rotate the ball clockwise and counterclockwise to help release the fascia underneath. You may even want to use a yoga block up against the wall with the ball in between in order to apply more pressure, and then just use your other hand in order to create the rotation. Now because the pec major is a big muscle, I highly recommend doing this on at least 3 different spots for 1 minute each. But what areas should you actually be targeting? You either want to look for areas that feel sticky when you try to stretch and you feel tightness in that one area, or you can also look at the tender spots within the chest, because chances are there's also fascia restrictions where those trigger points were. So now that you completed the pec major, let's move into the shoulder region. Now, you can do the same exact thing you just did with the pec major by using the lacrosse ball on the anterior delts, or you can grab a monster band and try this technique out. Anchor one side of the band to the wall while you slip your affected shoulder into the other side. You should be trying to get that band up on top of your affected shoulder as if it was a backpack strap. Now from here, step away from the anchor so you can get as much tension on the band as you can control, and then slowly rotate in and out of this movement. This is going to create a slow peeling effect on the shoulder, which will then help loosen your fascia. Do this for roughly 1 to 2 minutes. The next step is going to be the fascia on the back of the shoulder, and in order to work on this, I either recommend using an MB5 ball or a classic foam roller because it has a wider surface. To get started, lean up against the wall with your tool on the posterior delt. From here, slowly roll back and forth throughout the entire muscle and even the upper back where the rhomboids are. Now, this may not be as effective as the other techniques in breaking up the tissues, but it is effective in helping the tissues slide and glide on top of each other, which is just as important as breaking up these adhesions. Make sure to roll out the back of your fascia for 1 to 2 minutes. Thanks for watching. Now make sure to go watch this video up here because there's a good chance you'll enjoy that one as well. I'll see you over there.